Hi, in this video let's discuss the next set of topics starting from cyst located in periapical area. Periapical cyst, also called as radicular cyst or apical periodontal cyst or root end cyst, is usually located at the periapical foramen area. It's the most common odontogenic cyst, usually the infected tooth. When the pulp is necrosed, toxins exit through apical foramen, leading to stimulation of epithelial cell rest of Malleus present in the periodontal ligament in apical area, in periapical area. So this can lead to formation of granuloma, and subsequently, because of loss of blood supply, there will be cyst formation, right? So I'm sure you're aware of all of these concepts. And another reference, this reference is from Grossman. In one of the other article references, it's clearly mentioned that radicular cyst, also called as periapical cyst, is associated with apex of a non-vital tooth. And in fact, we have discussed in detail about periapical cyst both in endo and in oral pathology sections of RE classes, right? Moving on to the next topic, Strobel's principles are used in case control study, observational study, cohort study. So first of all, what is this Strobe? It's an acronym. Strengthening the reporting of observational studies, Strobel's transfer. So strengthening the reporting of observational studies in epidemiology, that is Strobe. So these are employed in observational studies, right? So some additional information pertaining to Strobe. The Strobe statement is outcome of an international collaboration established in 2004, which resulted in a set of 22 evidence-based recommendations for reporting of observational studies and is currently endorsed by more than 100 journals. An accompanying elaboration and explanation article was also published. Like all reporting guidelines, Strobe recommendations are neither prescriptions for the design or conduct of studies nor a set of guidelines to evaluate the quality of observational research. Rather, Strobe ought to be seen as recommendations to enhance quality, completeness, and transparency of reporting observational studies. Right? So it's related to observational studies. Strobe, strengthening or reporting of observational studies in epidemiology. Strobe. Now, another topic, HCl concentration in Kroll's technique. Initially it was 18%, but in modified technique it is 11%. So we'll go through some literature now. So McKean's, McKean's were discussed previously also. It's a mixture of 5 parts of 36% HCl, 5 parts of 30% H2O2, and 1 part of anesthetic ether. In 1980s, we have come across this phosphoric acid etching technique and all. We'll directly jump. We have a timeline wherein they have mentioned various discoveries along with techniques. In 1986, Kroll advocated a regimen to remove fluorosis-like stains from teeth that involved maximum up to 15 separate 5-second application of thick paste made of 18% HCl with a fine pumice powder, followed by 10-second water rinses. Kroll further modified the technique, reducing the concentration of acid to approximately 11%, increasing the abrasiveness of paste using silicon carbide particles in a water-soluble gel paste instead of pumice. Right? So that's the percentage of HCl in Kroll's technique. Now, moving on to the next topic, diathermy. So why is it used for removing warts? So what's the mechanism of action? So we have a process called fulguration. So destruction of a small growth or areas of tissue using diathermy. In fact, there are several articles which clearly mention that diathermy is used for removing warts through a process called fulguration. So what is this fulguration? A medical and surgical technique. In fact, fulguration as such is nothing but superficial coagulation, superficial destruction of tissues. As I said, destruction of small growths or areas of tissues. That's fulguration. But what is this diathermy? So a medical or surgical technique involving production of heat in a part of body with high frequency electric currents to stimulate the circulation or relieve the pain or destroy unhealthy tissue or cause bleeding vessels to clot. So we have numerous applications for diathermy which we'll discuss elsewhere, right? So diathermy method used for papilloma. So it removes warts through a process called fulguration, right? Moving on to the next topic. Strength of gypsum is expressed how? So I think there was a question in similar lines. Strength of gypsum is expressed as wet strength, green strength, tensile strength. So in Phillips, it's clearly mentioned that the strength of set gypsum materials or products is generally expressed in terms of compressive strength, although diametral tensile strength should be also considered to determine the overall strength characteristics, but generally the strength is expressed in terms of compressive strength, right? Moving on to the next topic. What are the advantages of piezoelectric surgery compared to conventional surgery? First of all, piezoelectric surgery is relatively new technique for osteotomy, osteoplasty that utilizes ultrasonic vibrations. It's essentially an ultrasound machine with modulated frequency and a control tip vibration range. The ultrasonic frequency is modulated from 10, 30 and 60 cycles per second to 29 kilohertz. The low frequency enables cutting of mineralized structures, not soft tissue. Power can be adjusted from 2.8 to 16 watt with preset power settings from various types of bone density. The piezo surgery tip vibrates within a range of 60 to 200 millimeters, which allows clean cutting with precise incisions. And when compared to conventional surgical equipments, piezo surgery has the following advantages. So this result, see, compared with traditional rotary instrumentation, piezo surgery requires much less hand pressure. This results in enhanced operator sensitivity and control, indicating that the clinician can develop a better feel, dexterity as well as feel and precision for cutting action because of micro vibration of cutting tip. The cut is safe because ultrasonic frequency used doesn't cut soft tissue. The cutting action is less invasive, producing less collateral tissue damage, which results in subsequently better healing. Owing to its cavitation effect on physiological solutions like blood, piezo surgery creates a virtually bloodless surgical site that makes visibility in the working area much clearer than with conventional bone cutting instruments. Unlike conventional burrs and microsaws, piezo surgery inserts do not become hot, which again reduces the risk of post-operative necrosis. So these are some of the advantages of piezo surgery compared to conventional surgical techniques. Now, moving on to the next topic. I'm not sure of this because few of you said using cosmetic products would lead to the following changes in oral cavity, or increase in the filler content in composite would lead to. So I'm not sure of the kind of question which you got, but when reviewing literature, FDA websites and all, it's clearly mentioned that most of the cosmetic products, take for example lipsticks and all, they contain high amount of lead. It's not, we're not talking about 1950s or 60s. Even in 2016, there was a guideline asking various manufacturers to eliminate lead from various cosmetic products. So I'll just go through some literature. 61% of lipsticks contain lead, which with levels ranging up to 0.65 parts per million. So ADA has given several recommendations and is asking the manufacturers to eliminate lead products from cosmetic products. In December 2016, FDA issued draft guidance to industry on lead as an impurity in cosmetic lip products such as lipsticks and other cosmetics such as eyeshadows, blushes, compact powders, shampoos, body lotions, etc. So obviously, if at all it is a kind of lead poisoning, then Burtonian line would be more appropriate answer. We discussed about various pigmentations previously, right? So let me know the question with more keywords. Will add up in the description part of the video. Now moving on to the next topic, primary oocyte. So there seems to be a question on primary oocyte, which stays in resting phase till which stage of cell division. So it's prophase. If you refer literature, with the onset of meiosis, the designation of germ cell changes. They are now called as primary oocytes. The primary oocytes become arrested in the diplotin stage of prophase 1, the prophase of the first meiotic division. Shortly before birth, all the fetal oocytes in the female ovary have attained this stage. And the meiotic resting phase that then begins is called as dictyotin, and it lasts till puberty, during which each month a pair of primary oocytes complete the first meiosis. Right? Now, moving on to the penultimate topic. Crushed spider appearance is seen in which of the following lesions? It's hereditary hemorrhagic telangiectasia. So it was first described by Osler, and It frequently bears his name, Osler-Rendu-Weber syndrome. It's transmitted as autosomal dominant trait. Crushed spider appearance. The typical lesion is cherry red to purplish macule or small papule that resembles a crushed spider, as you can see in the image. So crushed spider appearance is a feature of hereditary hemorrhagic telangiectasia. Now moving on to the final topic, zolpidem. Is it used as a hypnotic or antidepressant? See, first of all, zolpidem, zopiclone, they fall under the categories non-benzodiazepine hypnotics, right? So non-benzodiazepine hypnotics such as zopiclone, zolpidem, they're used as hypnotic agents, right? It's clearly mentioned in the literature. They're used as hypnotic agents along with benzodiazepines. So when indicated, benzodiazepines are the hypnotic of choice, and the newer non-benzodiazepine hypnotics such as zopiclone, zolpidem are also being used for hypnosis, right? Insomnia arises under a variety of circumstances. It could be long-term, short-term, or transient problem. So that's some information pertaining to non-benzodiazepine hypnotics. Example, zolpidem, right? So these are some of the topics which I wanted to highlight in this video, and we'll come up with another set of questions as soon as possible. I hope it's clear.